I've not been to Artemis yet.
Good morning. I have the honor of welcoming today's Grand Round speaker, Dr. Matthew Noorbakhsh. He's an accomplished trauma and acute care surgeon who was born and raised in Pittsburgh, Pennsylvania. He then moved to Virginia for college at William and Mary, where he had a Bachelor of Science in Biology, and then later went on to UVMS to earn both a Master's in Biomedical Science as well as his MD. He continued there for his general surgery training under LD Britt, and then pursued fellowship training at the renowned Shock Trauma Center in Maryland. From 2014 to 2024, he was at Allegheny General Hospital, which is a busy level 1 trauma center in Pennsylvania. While he was there, he established himself as a leader in trauma, as Associate Medical Director for the Trauma Program, Associate Program Director for General Surgery, and the Medical Director for the Trauma ICU. In his personal life, he met his wife, Kate, on the first day of medical school. She is an accomplished pediatric emergency physician in her own right, and they have 3 children, ages 15, 12, and 10. In 2024, we were very fortunate to recruit him here at UVA, where he now serves as Section Chief of Acute Care Surgery and Trauma. Please join me in welcoming Dr. Matthew Noorbakhsh for his Grand Round on Joy and Growth in Surgery.
Hi, everyone. Well, Dr. Sung, I'm more nervous about this than I think I've been about anything in quite some time. Bear with me. All right, I have no disclosures. I think it's working. Okay. I have no disclosures. I do have a disclaimer. I'd like to start by saying that a lot of this talk is just my personal perception. Really, I come at this talk with a stance of humility, and when I'm talking about joy and growth in surgery, these are deeply personal topics, and they're a little bit different for everyone. I don't presume that what I'm going to talk about fits with any of your experiences and your perceptions about your careers thus far and how you approach patient care, how you approach patient interactions, personal growth. But I'm going to tell you, as someone who's thought about these topics quite a bit, what I've learned and seen modeled for me by my mentors, and I hope that you can find one thing that's useful in your own life. I'm going to talk to you all about joy and growth in surgery. I'm going to ask you to consider joy in perhaps a slightly unconventional way. I'm going to talk about how we as surgeons are in a unique position to live within joy, bear witness to it in a way that others don't have the opportunity to do. I'm going to talk about how we grow as humans and as surgeons. I'm going to talk and ask you to think about how you work to improve and get better at what you do. I'm going to talk about how these topics are applicable to our trauma program. And for the residents, trauma surgeons, and others in any way affiliated with the trauma program, I'm going to ask you to consider how we can apply those lessons that we learned about joy and growth and apply them to making our trauma program better. The joy of surgery. What a ridiculous combination of words. I was a third-year medical student planning to go into OB-GYN to be like my dad, who's my hero, and me as a model of what a man should be. And my wife and I were looking through the UVMS course catalog to choose our 4th-year elective rotations, and she showed me there was a rotation called The Joy of Surgery. I thought it was a ridiculous thing to name a rotation, so of course I had to sign up for it. I chose it as my first rotation of 4th year. It was essentially an apprenticeship rotation. Dr. Wilkes Hubbard. The name worked, and I signed up, and I basically followed Dr. Hubbard around for a month. Dr. Hubbard's a UVA graduate, a thoracic surgeon, and general surgeon. He did esophagectomies and inguinal hernias, paraesophageal hernias, and gallbladders. And I spent a month truly living with this man in the hospital. Showed me what it meant to be a surgeon, what it meant to serve a community. To this day, I think that month with Dr. Hubbard might have been the happiest I've ever been in medicine. He showed me the joy of surgery, and the way he showed it didn't seem like a ridiculous combination of words. By the time that month was over, I felt it. I knew it. And I stayed at EVMS for residency, and I got to operate with that guy for 5 years. And I learned from him, and there were times when I know I frustrated him and disappointed him. There was never a time when I wasn't certain that he cared about me. He showed me what surgical mentorship was. He was the first one I called when I was thinking about taking a job here. Joy is such a human madness. In her essay, Joy, Zadie Smith writes about being on her way to visit Auschwitz while her husband was holding her feet. We were heading toward that which makes life intolerable, feeling the only thing that makes it worthwhile. That was joy. As Ross Gay writes in his beautiful book of essays, The Book of Delights, joy has little to do with pleasure. The holding one's love's feet is a pleasure. And having one's feet held by one's love is a pleasure. It has to do with this other thing Smith describes perfectly, if a bit Ridley, which seems perfect even as it is a bit Ridley. The intolerable makes life worthwhile. How is that so? Between Smith and Gay, they describe joy as being inextricable from grief, inextricable from despair, that it's a package deal. That pleasure and despair can exist because of each other, beside each other, highlighting each other, and that our human experience requires one for the other. I think that we as surgeons have some unique insights into this definition. There are not a lot of other professions which come face to face with despair as deeply as our field. And the relief and happiness at the other end of the spectrum when a family who was so close to losing a loved one starts to see recovery and hope. As I've come to think about joy more deeply, I've come to understand that the one doesn't come without the other, that it's this idea of joy as a package deal that helps me make sense of what we do every day. I think we've all had moments like this, where a patient's disease is devastating, or sometimes worse, where we question where someone else might have been able to save the patient where we failed. Think back on patients that I personally have taken care of, haven't been able to save. Do I think that Al Philp, my boss and partner in Pittsburgh, or Jay Collins, probably one of my mentors from Norfolk, who may be one of the best surgeons I've ever met, might have been able to save. I think about all the times we've looked back in hindsight, beat ourselves up for not managing something the way we'd like to have managed. I think that we have other times where we feel like Peter Benton from ER when he saved the patient with the aneurysm without any attending supervision. I know this is too old for some of you guys. For me, that was my Thursday nights in medical school, was watching ER. Whether it's your first skin-to-skin appendectomy as an intern, or it's Dr. Flanagan and Dr. Jordan getting the abdominal gunshot wound patient from a couple weeks ago to the OR in 10 minutes after arrival and controlling a bloodbath, multi-organ injury. There are times when we all do a mental fist bump. Hell yeah, that was pretty great. I've never done the actual Benton fist bump that I would admit to you guys. But if I see any of you guys do it, I promise I won't judge. It'll probably make my day. I'll see it as a delight. You know, I've known that I was giving this Grand Rounds talk for quite some time, and I was really undecided about what I wanted to talk about. Thought about talking about the trauma program here, talking about logistical issues and trauma systems, about frontiers in trauma care, traumatic brain injury, any number of EGS and surgical critical care topics. But a few months ago, I got this text from Alicia, followed up by a phone call. She'd just been part of a family discussion where there was a tragic case of a child who had suffered a terrible anoxic brain injury. It happened right as I finished a chapter in the book I mentioned, The Book of Delights, and it was this chapter of dealing with tragedy and joy. So when I got this text from Alicia, that's what was on my mind. It really made me think about how I personally process difficult cases and tragic events. And I think as I thought more about it, viewing tragedy as inherent to and as a necessary part of this larger concept of joy is how I've learned to make sense of these things.
You told an interviewer you had learned to, in your words, love the.
Long after that I ended up coming across this short video in which Stephen Colbert was asked about tragedy. His father and his brothers were killed in a plane crash when he was 10 years old, and he talks in this interview about how that impacted his life and eventually his worldview. I think this puts it in much more eloquently than I've been able to explain how I've come to view loss and tragedy. Please forgive the fact that the only way I could get this video into the presentation was to save it from TikTok. I don't have TikTok. When you Google video of Stephen Colbert having this discussion, TikTok is the only one you can save onto a PowerPoint. Or at least I can. I needed Andy Young for that one, I think, to make Google it. Andy would have found it on Reddit, I think. So forgive that. But as you listen to it, think about how tragedies you've experienced have allowed you to be a better guide to your patients or a better companion to a friend who's struggling with something.
You told an interviewer You have learned to, in your words, love the thing that I most wish had not happened.
I remember.
You went on. You went on to say, "What punishments of God are not gifts?" Do you really believe that?
Yes. It's a gift to exist. It's a gift to exist. And with existence comes suffering. There's no escape from that. And I guess I'm either a Catholic or a Buddhist when I say those things. But I didn't learn it that I was grateful for the thing I most wish hadn't happened, is that I realized it. If you are grateful for your life, which I think is a positive thing to do, not everybody is, right. And I'm not always, then you have to be grateful for all of it. You can choose what you're grateful for.
You know, I was first thinking about coming here. When I first arrived, I struggled a lot with the idea of the big move, of uprooting my life and coming to a new place. I'd like to take a couple minutes to talk a little bit about my arrival here and how it intersects with joy, and then later how it intersects with growth. Many of you know I came here from Pittsburgh. I grew up there and I love that city. Love it. Family and I have been there for the past 10 years. This is the hospital I worked at, Allegheny General. Interestingly, after I left, like months after I left, they filmed at AGH and debuted the pit. And here's a picture of all my friends getting to meet Noah Wiley. And I didn't get I came to visit again last week, and I didn't get to meet him again. But I had a wonderful work home there. Things were moving along really nicely for me career-wise. I was very comfortable. I had a really great life. I lived in a little house in a neighborhood called Morningside, a little Italian neighborhood, a bunch of Italian grandmas for my kids. All of our kids lived within 3 houses. All of our kids' friends lived within 3 houses of ours. There's a gaggle of kids running between our houses at all times. This is a picture from the day that we left for Virginia, taken moments before everybody was bawling, crying like little babies. And we had a life there that was filled with all sorts of joy. You know, I've talked a little bit about this book, or a lot about this book. But it's a book of small essays in which Ross Gay beautifully describes these delights, so these little moments that he experiences throughout the course of the year. And he catalogs all of the delights that he notices throughout the year. And since reading it, it's really a wonderful celebration of gratitude and joy. And since reading it, I've started to pay more attention to the delights in my own life. It's become a really nice gratitude practice to always be on the lookout for these delights. I had my own delights in Pittsburgh. You know, there was this shopping district called the Strip District. It's amazing, cool little area where I could go after being on call and awake all night and go to the cheese counter and buy all sorts of cheese and lunch meat. I'd go to the Mexican grocery store, and I was best friends with Kathy, who ran the Mexican grocery store. It was, these people became really good friends and had a really nice set of delights there. If it was all possible, I'd play as many post-call rounds of golf as I could. I'd join this golf course that, I just loved. It was a beautiful place. I was out in nature. I really had this third space where I could socialize, work on improving in an impossible game. Every Wednesday, I'd lose $10 to an 80-year-old. Every time out there, I was delighted. And so saying goodbye to these sources of joy was, in a word, sad. I was excited about the prospect of a new adventure, but I was sad to leave all these things that I'd grown to love. I trusted in the leadership of these 2 folks. I believed in them and their vision. Trusted that they were going to do everything in their power to help me make this a successful transition. And I was coming to the University of Virginia. I think it's easy to be jaded by this. But when you're in it, it's easy to be jaded by this. This place is amazing. The place is amazing. It's a special place. The history of this place, everything about this place is really amazing. And I'm admittedly totally a sucker for that stuff. Right? So I set out learning about how to fit in and succeed in the new environment. I felt like I knew how to be a trauma surgeon across a fair range of environments. I felt like I'd spent the last 10 years learning from excellent trauma director and mentor, but I didn't know how I was going to fit in here at UVA. Moved into our house in the middle of July, and we reveled in the beautiful Virginian landscape. Sat on the back patio every evening with a glass of wine. Kate and I we'd pinch ourselves every night, and I can't believe we'd say, I can't believe I get to live here. And a bunch of family come into town 2 weeks before I was slated to start. Everybody was there from all over the country to visit and celebrate with us for our big life change. In the midst of these celebrations of a life change and enjoying the first consecutive 2-week stretch without clinical responsibilities that Kate and I have had since 4th year of medical school, I did begin to get some worrying signs of the difficulty of the situation, though. Then on the same day as that message, I got this message. My start date was 2 weeks away. Felt like everyone was vibrating up here. And hopefully, I'd like to think of myself as a vibrate down here kind of guy. And eventually, I finally had my start date. I did the onboarding stuff. Found out after I arrived that the person who had been working with me on onboarding had just been separated from UVA, so I didn't actually have an onboarding person. The day of my first call, ValQuick helped me get Epic access and Vocera access. That came through at 3:30 p.m. on the day of my first call that started at 4 p.m. Went through the night with 0 trauma activations, freaked out the entire night that my phone wasn't working. I texted the chief 843 times. Very kind and reassuring me. And then as mentioned, in 90 days, I was set up with a whole bunch of meetings. I met with several of you guys. Spent that time trying to learn as much as I could about UVA, the trauma program, the SICU, our OR, outpatient clinics, etc. And you know, my goal and plan was to withhold making any judgments or assessments and to just gather information, which I'd synthesize into common themes later. Then we'd all get together, everybody would high five, and we'd get to work. But instead, I left many of those meetings feeling like this. You know, it's easy when you work. You know, I think the thing is, it's easy when you work in one place for a long time, like I had, because you get used to the problems of that place. And the things that work well in that place, you just take for granted and you say that's how everywhere works. And you know, you're blind to the difficulties. I mean, I admitted 10 elderly trauma patients with isolated subdurals on my shift, and I thought to myself, oh, that's just trauma. That's just how it is. But also we had a dedicated trauma room, the ability to get a craning from arrival in the emergency department into the operating room within 25 minutes. And I just thought that's what every place does. You know, that's no problem. So you get used to the things that work well at the previous institution, and you stop paying attention to the problems at the institution, at the previous institution. So it became clear to me, though, that through these meetings, that there were some challenges that were just different from what I was used to. And over the course of my meetings, you know, we had certain themes that arose. We were down to 3.5 surgeons, with one, a giant in trauma surgery nationally, Dr. Young, retiring in 6 months. There were concerns of SICU, about coverage of SICU while operating on call and responding to trauma activations. We had some recent adverse events due largely to system issues, and I met with folks throughout the hospital. It was clear that it affected our reputation housewide as a group. We had an urgent need for more trauma surgeons. There were concerns about emergent OR availability and the inability to get EGS cases done during daylight hours, impacting our ability to function. And then we had site survey risks. You know, one of the main risks was just being down to 3.5 surgeons and having lost 3 trauma surgeons in the past year. I mean, how that's going to look to a site surveyor who comes in and they're going to come in and say, goodness gracious, this place doesn't care about, you know, the administration does not have buy-in for the trauma program. So we had to try and fix all of those things or work on all of those things. And we had 10 months before our ECS site survey review. And then less than a month in, I get this text. And the undercurrent of worry turned into a moderate panic for me. And it's about at this time where I'm starting to really relate to the goat from Jurassic Park, and my role in this movie is to be eaten by the T-Rex. The saving grace, though, were the people. My new partners were kind and caring, competent, excellent surgeons. They clearly had grit, having survived what they had over the past year, being short-staffed, lost trauma surgeons. You know, this was really a defensible core around which we could grow our group into what we wanted it to be, and they were rock solid. The trauma program side, we had an amazing trauma program manager, ValQuick. She'd been quietly working to build the infrastructure and working with Molly to create a great PI process to make it possible to rapidly make any changes we needed to make them. You know, we had an amazing PI staff. Andrew Baxter's not pictured on this, but he and I met on multiple occasions. He was really a good mentor for me. He has a lot of leadership experience, intimate knowledge of the trauma program, and he really functioned as a coach for me. And then there was an absolutely top-notch group of residents. And I've seen residents at other programs, a number of different programs, and these folks were the cream of the crop. They could function independently. They were dedicated learners. Most importantly to me, they treated me with kindness even though I was an outsider. There's no reason why these guys had to treat me as well as they did. They were really kind. I'll be forever thankful to this particular group of residents as the first group that I met upon coming here and the kindness that they showed. Start to talk about joy, or now I guess the middle of a talk about joy, with a slide about tragedy. I've done more reading on joy than any serious surgeon would admit, and as I mentioned, I've come to think of joy as a more complex topic than the traditional definition. I hope as I go through this talk, I can give you some of my perspective on the interaction between tragedy and joy, and I'm able to help you see my